eighth cranial is the vestibular cornea now, and we are testing the cochlear component of the eighth. So cochlear component is responsible for hearing. So we have three tests: hearing test or tuning fork test. And previously we had a watch test. What in watch test we do is we will keep the watch and ask the subject to check to tell whether he is hearing the click sound of the watch. Okay. Nowadays we are going for only the tuning fork test. Okay. The tuning fork test, the tuning fork of frequency 256 Hz is used. Okay, 256 Hz is used, and you have to hold the tuning fork like this, and you have to vibrate the prongs by striking over the hypothenar eminence. Okay, and you have to place the base over the mastoid process, and you have to check for the hearing. Okay, never hold the tuning fork like this. You should not hold like this. Okay, always hold like this, and you strike. You can use your hypothenar eminence, or you can use the heel of the shoe. This also you can use for striking the tuning fork. Now, the first test is the Rinne's test. What is Rinne's test? Rinne's test says the air conduction is better than bone conduction. The air conduction is nothing but the normal conduction of the air. From the air, it goes to the middle ear, then goes to the inner ear. The bone conduction is we are going to place over the bone, and the bone will be directing the sound directly to the inner ear, bypassing the middle ear. So that is bone conduction. Bone conduction is just simply bypassing the middle ear. Whereas air conduction is the normal conduction everyone are having. Normally the sound will pass through the external ear, middle ear, then goes to the inner ear. Next. So first we will go for Rinne's test. Strike the tuning fork. See, you give an instruction. So you close your eyes. I will place the tuning fork. Once the vibration is over, I will place it over the mastoid, over the bony portion. Once the vibration is over, you tell yes. Then I will place it in front of the ear. You tell whether it is heard or not, and if it is over, you tell yes. Okay. This is Rinne's test. I am striking the tuning fork. Place it over the mastoid process. Over. Here. Hearing. Good. Hearing. Yes. Over. Okay, it is over. So you can compare with the example. So what we are conveying here is, first we are keeping it on the mastoid process. Once gets over, we keep it in front of the ear. So this is bone conduction, and this is air conduction. So air conduction is better than bone conduction. This is normal. In a normal ear, in the ear is normal, air conduction is better than bone conduction. This is called Rinne's test. Positive. See, in the entire medical field, a test which is positive for a normal person is Rinne's test. Rinne's test, when it is positive, means the person is normal. If the person is not able to hear the sound when it is placed in front of the ear, it is called Rinne's test negative. It happens in conductive deafness. Next we go for, so you have to do on both the sides. Okay, I am going to do on this side also. Close your eyes. You feel the vibration. Yeah. Hearing. Good. Over. Now for him the air conduction is better than bone conduction. Okay. Weber's test, you strike the tuning fork, place it over the vertex. Once gets over, you compare with yourself. Okay. Or you can place it over the nasion. This is nasion part, that is in between the two eyebrows. Once gets over, you check. Weber's test, we are conducting only the bone conduction. So what we are testing is only bone conduction. As I already told you, bone conduction, the conduction of sound is directly going to the inner ear, bypassing the middle ear and external ear. So you are comparing the bone conduction on both the sides. If one ear is having any hearing deafness, the cause is due to nerve, then the bone conduction will be less on that side of the ear, and bone conduction will be normal on the other side. If bone conduction is poor on one side, we can suspect a neural deafness. The cause for deafness is the nerve damage, so neural deafness. So always remember, conductive deafness occurs when there is any conduction block. The disease mostly in the middle ear. And neural deafness, the disease will be in the cochlear nerve or in the inner ear. The inner ear damage will have the defect in the bone conduction. Okay. So this is VBUS test. Then we go for absolute bone conduction test. Absolute bone conduction test is a very simple test. You are going to conduct, you are going to compare your bone conduction with the subject's bone conduction. Okay. There will be comparison taking place between the patient and the subject. Close your eyes. Once it gets over, you tell me.
Over.
Okay. So these are the three tests: Line's, VBUS, and absolute bone conduction.